All right, class, in this video, we're going to be demonstrating a focused respiratory assessment. We would be using this for somebody who came in with shortness of breath, accessory muscles breathing, and anything of that sort. So let's go ahead and get started. The first thing we're going to do is we're going to inspect our client. So obviously we've done our introductions, we've done everything we need to. Now we're getting straight into the assessment. So I'm going to inspect my client. To do this, we're going to let them know that we will be removing their gown. So once I've let them know, I can go ahead and start removing. And I'm going to inspect their overall appearance. So I'm going to look at their skin, I'm going to look at their breathing effort, I'm going to look at their facial expressions, and I'm looking at their skin color to make sure it matches their tone. Once I notice all of that, I'll document it, and then the next I will look at is their rate, so their breaths per minute. There will be a separate video for this that you would want to watch. But I'm making sure that their depth is either shallow or deep. I'm looking if the rhythm is regular or irregular of the respiration, so that's what I'll be checking on the chest. Next, I'll be looking at their use of accessory muscles. Are they using their neck or their abdominal muscles, which I would be looking down here, to see if they are using these muscles to help them breathe. That would be a sign of respiratory distress. And in these moments, I'll be looking for any other signs of respiratory distress. Next, I'll be looking at their chest for any deformities, if they have barrel chest or anything of that sort. I'm looking for symmetricalness. I'm looking for any abnormal chest movements. While we're looking at their skin, I'll be looking for cyanosis, any pallorness. Next, while we would cover the patient back up once we are done with that. Next, we will be looking at their fingers. I'm looking for any clubbing of the fingers. I'm looking for any lesions or scars on the chest wall, which I did when I was looking at the chest. Now I'm looking for their pulse oximetry levels. So I'm going to pull out my pulse oximeter. I'm going to apply it to the finger that is assigned to our simulation person. So for demonstration purposes, I cannot show the numbers, but you would be looking for 95% to 100%, and then it will show their pulse as well. Lastly, I'll be using a stethoscope to listen for clear breath sounds, and I will be demonstrating the points for that. So once again, I will be having to remove my patient's gown. So I'll start from the top once I have let them know. Okay, once the chest has been exposed, we will start on one side, start at the top of the lungs, listen for one full breath and ask them to take a deep breath. That would be one full breath. Now I'll move to the right. Deep breath for me. Go down, deep breath. Deep breath. When you get to the bottom, you want to go a little bit to the side to get the base. One full breath. Other side, and one full breath. So that'll be the 6 points in the front. Now we're going to look at the back. So I'll ask my patient to sit up for me. All right, so once our patient is sitting up, just like from the front, we're gonna start on one side. At the top, one full breath. Then we're gonna go on the other side. Take a deep breath for me. Then I'm gonna go down from here in the middle. One full breath. Then I'm going over here, one deep breath. Then I'm going down. One last spot. And that concludes our respiratory assessment. If you have any questions, feel free to ask. We'll catch you guys in the next one.